Hola amigos de las cosas de Mimi. Hoy estamos en Evolution MD con la doctora Kim Lee. Hi.
Hello, everyone.
Yes. Dr. Kim Lee is a formally fellowship trained in cosmetic surgery with a specialization in body, face, aesthetics surgery with more than 10 years experience. So thank you for your time. It's the first what I want to say. And okay, when the patients arrive for here first time at the Evolution ND, what they expect.
Expect that we go through all your medical history, getting to know you. We ask certain questions and see what your interests are and what your goals that you have in terms of your overall expectation, like what the results you want to have. And we go through your consult and we look at your body. We kind of match everything. We put everything into your goals, but also to see if what will look best for your body frame.
That's good.
And I think the importance of having the consultation with us is so we go over every opportunity, every option there is for you, and ultimately you decide what is best in terms of what you have support at home, what are you comfortable with, how aggressive the approach you want to go for. And my part as a surgeon is to tell you if what you had in mind is realistic and reasonable. Not everyone can look like a Barbie doll.
Yeah.
But I want to make you feel more comfortable, more confident in your own body and skin. And that is my goal for everyone that comes here.
Yes. So what service do you guys offer?
We pretty much offer everything. So non-surgical to surgical. So non-surgical meaning lip fillers, cheek fillers, lasers, massages, lymphatic massages. And then going more of a surgical approach, we do a lot of body work here. So liposuction, BBLs, what we call mommy makeovers, which is a breast procedure and a tummy tuck. But we do everything else, vaginal rejuvenation, we do facelifts, we do eyelid surgeries, we do a lot of surgeries for males. So, abdominal etching.
I saw the pictures on the side that you have in here.
Yeah.
Say, okay, well, it's a lot of men doing things.
Oh yeah, surgeries is not for women only. There's a lot of stigma, or not a lot of men like to talk about it, about receiving surgeries. But it's a great way for also men to improve their self-confidence, their looking better in their own skin and body. So, like I said, abdominal etching, lipo. There are male enhancement procedures with penile filler. And just body etching, gynecomastia, which is when men have very feminine breasts and you want to correct that. So there's lots of options for men too.
Oh, that's good. That's good. So, can multiple procedures be done at the same time?
Yes. So it really depends on the person. So that's why we ask all these health questions. We want to make sure that you're healthy enough to go through multiple procedures. We want to make sure your heart is healthy for the general anesthesia. And so that's why we ask, like, if you have any medical issues, what medications are you taking, and what surgeries that you had in the past, because that really paints a picture of how well you can tolerate a bigger procedure or a combination procedures. So, it really is dependent on the patient.
Depend on the patient.
And two, how well is their support system at home? I don't want to do all these procedures on one patient and they come tell me that they have no one to take care of them. So that is one of the main reasons that I would tell
no. It's like a no-no.
Yeah, because if you stay in bed and no one takes care of you, no one washes, help you shower, then those are all problems that can lead to bigger issues down the road.
Yeah, I understand. So do the procedures have an age limit?
No, so I see consults all the time. It's so funny. I saw like a mid 70-year-old woman, very healthy, of course, but she wanted a BBL
Oh my
at
God.
at 70 something. So I was like, more to it, you know. So there's no age limit. Again, we want to make sure you're healthy enough. We make sure your heart's healthy, cardiac clearance, medical clearance before you have a surgery. But there's technically not an age limit. People get facelifts all the time in their 70s, 80s, but they can talk. We have to make sure you're safe enough to go through these procedures.
Okay, so are you able to give consult remotely?
Yes, so I have a lot of out of town, out of state. I have people travel from other countries before, so the only way to do consults is by virtual, either by FaceTime, WhatsApp, and then obviously over a phone call as well.
So it's very good
Yeah.
also.
The best is to come in person because I can see your body, look at your skin. There's a lot of things that can be missed with pictures alone. But if we can't be in person, then obviously a virtual or a remote consultation is the next step.
That's very good. So in this center, have any kind of discount offers, promotions?
So if you catch us at a good time, like during holidays or like before summer, we always have promotions. We kind of advertise them, like we're having a special or we have a live Instagram promotion, and it's always nice to follow us on Instagram so you're in the know of certain deals and promotions. And obviously, when you reach out to the sales consultants, they are the ones that know the current deals. I don't. I just show up.
I know that's a part of
So it's really on social media, or you just reach out to us to see if there's any promotions or discounts or deals going on.
Yeah, one time I heard that there's something, there are raffles at the
yeah.
cleaning and the lucky patient can win like procedures and not cost. I hear that in one moment and say, okay, I would like to be in that raffle.
Yeah, I know.
Yeah. But that one happened like
the best times is during major holidays. So like before Christmas, before Thanksgiving, we always do something holiday related.
Okay, so what would you say to followers of these channels about this place? What you want to say?
I think we have a great team here. We all work well together. We support each other. And it's really great how the structure it is here at Evolution ND. We have a 1-to-1 ratio of nurse to post-op. Like when you recover, anybody recover, you have one nurse taking care of you. And for those that don't know, that's even better than ICU ratios. So when you're in a hospital, the ICU nurse can be taking care of 3 patients at the time and sick patients.
Yeah.
So here you're one-on-one with a nurse, so you know that you're well taken care for. And I think that's the beauty. We run like a hospital, but in an outpatient setting. So it's very safe, it's very clean. Everyone is enjoys their time here. So it really shows when the patient comes in.
It's very nice when you can go through that doors. Everybody's very gentle. Tell you, come on, we like to, stay with you. Nice. It's just something good to feel it. So one more time, thank you.
You're very welcome. Thank you
for this. Yes, for this little conversation, because it's no interview. It's a conversation. Yeah. And you can call here. So I'm going to put on the address and phone number for this place so you can reach, and then a lot of people can talk to you, have different language, and so it can help you in many ways. Thank you one more time, and we see you again en Las Cosas de Mimi. Gracias.